The pandemic has had a dramatic impact on our lives, to say the least, and that includes mental health.
Yeah, so this morning, our Sandra Ali is sharing a very important and, quite frankly, a candid conversation with mental health experts about the crisis that they're seeing and who's most vulnerable right now.
Many of us are facing challenges that can be stressful and can cause a lot of emotion. Even therapists and psychologists have really been overwhelmed, treating more patients than ever this past year. Now they're sharing their experiences and taking a look at what's ahead as we move forward.
Never in my 22 years of practice have I had so many individuals on my patient load at one time.
Over the course of the coronavirus pandemic, Dr. Rose Moten has received more requests than ever before.
People are seeking the help. So I am pleased to know that people are not allowing themselves to suffer in silence.
It has been challenging, but I've also seen a level of resiliency.
The same goes for Detroit-based therapist Whitney Jenneret.
A lot of clients willing to work and willing to persevere and figure things out.
The early stages of the pandemic, followed by lockdowns, were hard for everyone.
It really helps for people to know they're not the only ones experiencing this. We can't even really start the true healing process of recovering from trauma or crises until the crisis has passed.
Part of it is identifying what was that individual's experience during this time. It will look different, depending on what was going on for that individual.
Individuals who've never experienced any type of mental health crises for the first time in their lives are experiencing anxiety, depression, and this is something that is new to them.
So where are we now?
It's okay to let people know I'm struggling and finding the resources to, work through some of those struggles. I think that we're making that part of the dialogue, and COVID has definitely given that opportunity.
We need to see our community come together as a whole to implement mental health and mental wellness initiatives to help educate people on what potentially they could be going through that they can actually get help for. Because the beauty of all this is that we can all get past this. We can all heal from this, but it's not going to happen unless people understand what exactly is happening to them.
For more than a year now, children have been trying to make sense of their new normal. They've been socially isolated, dealing with stressed out parents and school from home. Both Dr. Moten and Whitney agree children have suffered the most during the pandemic.
They're not just falling behind academically. They're falling behind emotionally and socially and psychologically. And we have to put a lot of focus on helping these kids just regain some of these key developmental milestones that may have been missed during this time.
Our children, they're struggling in a way that I don't even think they can identify right now. I don't think parents quite get it, but unfortunately, we do have a road ahead.
New research from a recent Census Bureau survey done in February shows the pandemic is disproportionately affecting the health in communities of color, specifically when it comes to both anxiety and depression.